The Central Intelligence Agency predicts that Taiwan will have the lowest fertility rate in the world in 2021, with an average of 1.07 births per woman of childbearing age.
Speaking at a rare public appearance on Tuesday, former Premier Mao Chi-kuo weighed in on Taiwan's birth rate crisis. He said the government should do more to provide access to fertility treatments.
This little girl doesn't care to be held, and she orders her grandpa to let her down. Look close and you'll notice grandpa is none other than Mao, the former premier.
Every night she'll come up to the 4th floor. She lives on the 3rd floor and I on the 4th. She comes over and does what I call creating havoc in heaven. Every time she's upstairs, no matter what work I have on hand, I have to put it down and make her my priority.
This 2-year-old is a former premier's granddaughter. His daughter is here too, holding his 3-month-old grandson. This happy family portrait was a long time in the making. His daughter realized her dream of having kids using in vitro fertilization.
We had actually been married for 5 or 6 years. It was quite a long time. Of course, we also weren't trying that hard. We thought we would leave it to fate and try on and off. But now I think that with something like this, you have to be proactive. Age is the worst enemy of fertility. When a woman is over 40 years old, the quality of her eggs begins to decline, and their survival rate becomes relatively poor.
According to the latest CIA forecast of global fertility rates, the bottom 5 economies are Hong Kong, Macau, Singapore, South Korea, and Taiwan. Taiwan ranked last with just 1.07 births expected per woman of childbearing age. According to Taiwan's Interior Ministry, there was a record low of 165,000 births last year, more than 12,000 fewer than the year before. Speaking on the low birth rate, former Premier Mao said that besides providing childbirth subsidies, the government should also address the issue of infertility.
If you're unable to get pregnant, or if you can't carry a baby to term, the postnatal subsidies are useless to you. Assisted human reproduction should be covered by health insurance.
Subsidies for in vitro have been available since 2015, but because they're restricted to low and lower middle income households, only 7 births have been achieved through the program in 6 years. Mao said Tuesday that the government should adjust its population policies to give more support to families that want to conceive.